Hello and welcome to the Sit Rep. This is one of our video podcasts, and I am joined by Mark Zackius. Did I say that right, Mark?
That's correct, Mark Zackius.
And you are a nurse at the VA Bedford VA Medical Center, and you've been there for 2 years now?
Just a little over 2 years, yes.
And before we got on camera, you had said that you specialize in spinal cord injury, and that right now your focus is in nurse education.
That's correct.
And what does that entail?
Basically, we go around for new employees or clinical orientation. We make sure that all the nurses have all the tools they needed to go onto the neighborhoods, units, floors, so they can do their job. So they become familiar with the VA.
And you've had, so this big reason why you're here today is to speak about quite a unique experience you had, and that you were one of the individuals, one of the many individuals actually from VA New England who volunteered to go down to New York to help out the facilities down there.
We were among the first.
The first couple of days you spent in Brooklyn.
That's correct.
And then the remainder of the time was in Manhattan. That's like ground zero. What was that experience like?
I would call it pretty much ground zero. It was intense. It was constantly busy. We were working 12-hour shifts. There was a lot of things going on, a lot of death, but there was, like the first week, there was some success stories too. And how we dealt with that was just doing our job, teamwork, but also trying to have some humor and things. But there's also support. As I mentioned, about 7 o'clock at night, people would hang out their windows and clamor pots together, clap their hands. So
that's cool.
It was a special experience. Kind of choked me up a little bit.
I can't even imagine what it was like.
But in that regards, the second week was just sort of like the opposite of the first week, where the first week there was a lot of death. The second week, there was a lot more people going home. So, and some amazing stories with that. Some young folks that were intubated, and the prognosis was pretty slim. This one gentleman, about 33 years old, couldn't even lift his arms up. And in the matter of 3 or 4 days, in 2 days, he was walking to the bathroom, and in about 5 days, we discharged him home with his family.
That's incredible. And so you yourself, you served in the military.
I did. I was in the Army.
And so your experience in the Army, I imagine that your experience from the military helps out in all sorts of shapes, forms, and fashion, especially with working with the cohort that you do, those being veterans, on a day in, day out basis. But just from a logistical standpoint and from a process standpoint and the emergency preparedness standpoint and all of that, going down to New York and helping out there, how much did you really rely on the tools that you had learned while you were in service?
I would say going through that training, it put me in the mindset completely of that. You just view it as a deployment. You have to get ready. And then there's all the support and those people that help you get ready with the travel, logistics, and everything like that. And then when you arrive there, there's a whole group to receive you. So like going into the reception station. And then while you're there, your mindset is, not spreading the disease, so to say, but protecting yourself and making sure others are protected. I don't know. It's just like, it just sets you in that mind frame that this is what I got to do. This is the service. This is how we get through. This is how we're successful. Accomplish the mission was a big thing in the military. So
mission oriented. Yeah. And so what was your work schedule like? I mean, in my mind, all I know is what I've heard on the news and what have you, where people are working 12, 14, 16-hour days, like nonstop, no weekends, no holidays, no nothing. It's just bam, 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 same thing every day. Was that the case for you?
That was the case for us. It was go, go, go. My buddy, warrior buddy, we were 12-hour shifts. She was on evenings. I was on days. We went 7:30 in the morning till 8 o'clock at night. I did. Usually we'd show up early to make sure things were set up so things would go well on the unit. And it was 12-hour days. Unfortunately, the most difficult thing for me was finding good food to eat. But all the restaurants were closed and things like that. This was New York City. And what an experience. New York City is more like 12 cities in one instead of just, there's big buildings everywhere. I'm from rural Missouri, so it was quite an experience there. But we had sandwiches. Sometimes the doctors ordered food brought up, which was greatly appreciated. Sometimes the families had sent in, meals because we were taking care of their family members. But other times there were meals that is just like a candy bar and some soda drinks or something to keep you going, or the caffeine, whatever. So,
and out of the experience, what do you think was? I mean, that I can't imagine how many different things you've taken away from it. But what are some of the tools that you learned while you were down there that you're now able to share with people here in Bedford, Massachusetts?
There's a lot there. The big thing there that amazed me was you had a group of people there, nurses, registered nurses, LPNs, nursing assistants from a wide variety. Anastasia was from dermatology. Jeremy was from urology. I was from nursing education. But the one thing that put us all together was nursing. We all came together, and it was excellent teamwork, excellent dedication, hardworking. Some of it was memories from the past. The first time I did a dialysis took me about 90 minutes, which should have only taken about 20 minutes for what I was doing. Mm-hmm. But after you did that the first time, and then if I wasn't sure about a heart code, I could ask somebody about it. They put me on the unit because 5 years ago I had worked with telemonitoring, heart monitor stuff. So because I had that experience, they needed those old skills there, just because they were so overwhelmed with how they were hit there and their workers and everything.
So were you staying downtown Manhattan or?
Right downtown. I was a mile from the VA, and that helped with stress, so to say, because walking to work and walking back, even in the rain, and it was nice. You got to experience some of New York City and saw some of the sights along the way. We were kind of between the VA and Central Park. We were in the middle.
That must have been quite an eerie experience, though, to be, I guess, potentially at times the only person that's on the street.
Yes, it was. But even on the street, walking back and forth at night or in the morning, there were still the homeless that were out there. And several of them always camped out in one spot. And sometimes it was interesting. On one day, I got to watch one person set up his little camp in this doorway, and his whole system there of getting things set up so he could sleep securely and dry. So.
And so what was your big takeaway from the entire experience? I mean, I imagine there had to have been a lot of, you've done a lot of reflection, I have to imagine, on the entire experience. And the reflection will probably continue forever. But what was your big takeaway personally from this experience, volunteering down in New York?
It was a great experience. I'd do it again. They asked for volunteers. I volunteered. with that, there's a lot of support that comes, because when I left from here to go down there to help, there were people here that had to take over what I had to do. And it definitely is more rewarding, or gives you back more than what you put in. And I don't know how to really put it in words, but it's just, again, that feeling of a teamwork, or this is America, we'll do it. So, and being there, working with Jeremy or Josh from Maine, you made a whole bunch of friends.
Mm-hmm.
So, and one can never have too many friends.
No, you cannot. Well, Mark, I greatly appreciate you coming in and talking about your experience. On behalf of all the veterans and families and the nurses and doctors and all the staff that you had helped out down in New York, on behalf of them, thank you very much. And then on behalf of VA New England Healthcare System, thank you for volunteering, going down there and continuing to serve our country.
You're welcome, but I couldn't have done it without you. I couldn't have done it with Vision One and VA New England. So couldn't have done it without the experience from the veterans and all those that I served with. Being a service, that's our job. So thank you.